Hi all, this is Murshida Yasmin, Assistant Professor from SNS College of Physiotherapy. I'm going to discuss about the low back pain. So low back pain is a prevalent condition affecting millions globally, often causing discomfort, and it is limiting the day-to-day activities of the person who's having low back pain. So in this presentation, I'm going to provide an overview of low back pain, which includes its causes and symptoms of low back pain and what are the treatment options available for the low back pain and how are the prevention strategies work for the low back pain. So by understanding these common elements, we can better manage and mitigate its impact on our life. Let's start with understanding the causes of the low back pain. So main causes of low back pain are muscle strains, disc related problems, arthritis, skeletal irregularities and injuries. So muscle strains causes heavy lifting or some sudden awkward movement will result in the muscle strain. The disc problem causes are herniated discs or bulging discs which can cause the pressure and irritate the nearby nerve endings that will lead to low back pain. Next, arthritic changes in the spine or arthritic changes in the hip bone, which is the condition like osteoarthritis, can lead to lower back pain. Skeletal irregularities or skeletal abnormalities such as scoliosis can contribute to discomfort, which will further lead to low back pain. Next, injuries like sudden accident or sudden fall can result in the acute pain in the lower back. In this picture, you can see the various causes of the low back pain starting from non-mechanical disease processes, heavy lifting which causes muscle strain, sudden trauma, poor sitting posture for prolonged period of time, and frequent bending forward activities and degenerative conditions such as arthritis. So these are all the causes which can lead to low back pain. How we can recognize the symptoms of the low back pain. So these symptoms will act as a key indicator to seek help for the low back pain effectively. So the first symptom is the dull pain or sharp pain in the lower back, which can occur suddenly or gradually progress over the time. The second symptom is the radiating pain. The pain may extend from lower back to buttock or leg, which is often associated with sciatica. Next, the third symptom is the stiffness in the lower back area. So that making it difficult to move or stand up straight. So the fourth symptom is the muscle spasm. The muscle spasm around the lower back area, which is a sudden spasm, which is catchy in nature, and the painful contraction of muscle during activities can occur, which may lead to discomfort and it will limit the movement. So these are all the differential diagnosis of low back pain. So the first one is lumbar strain or sprain. The next is the degenerative disc or facet processes. Then herniated disc, osteoporotic compression fracture in the spine. Next is spinal stenosis and spondylolisthesis. So these are all the differential diagnosis of the low back pain. What are all the effective treatment strategies available for the lower back pain? So initial treatment includes resting the area which is paining and icing the area to reduce the inflammation. The next one is the physical therapy. Yes, obviously engaging the patient in exercises that enhance the flexibility and strengthen the key muscles which will help you to elevate the lower back pain. Next is the medications. Use of medications like NSAIDs, which is specifically ibuprofen, to elevate the pain and inflammation. Advanced options like corticosteroid injection and surgical interventions may be necessary in severe cases. In comprehensive approach, we need a comprehensive strategy and also to seek a medical professional for tailored treatment plan is necessary. What is the essential role of physical therapy in low back pain recovery? So there are many essential role of physical therapy in low back pain recovery. So the starting with the strengthening the core muscles, which reduces the strain and also it will enhance the stability during the movement. Next is improving the flexibility of the spine will help you to ease the mobile action and also will reduce the stiffness, which allow for greater range of motion and it will reduce the discomfort during day-to-day activities. And also the third one is the major important aspect of physical therapy. We have to educate the patient on body mechanics, movement techniques and safe lifting procedure that will help to further prevent the injury and promote the proper posture in daily activities and their day-to-day tasks. Then we have to plan the treatment by customizing for each patient, which needs to ensure effective recovery. So addressing specific pinpoints and specific pain points, specific trigger points, which will enhance the overall treatment outcome. Next, engaging with the therapist. So, the patient with the therapist during a regular session, they need to engage with the therapist and also they will provide the guidance, support, and accountability in the recovery. The medications commonly used as a strategy for pain relief are non-steroidal anti-inflammatory drugs, muscle relaxants which helps to relieve muscle spasm, then topical analgesics which act as a counter irritant for the localized pain relief temporarily. Then in case of severe pain in chronic pain, antidepressants can be used as an alternative treatment pathway. So we have to consult the healthcare provider for the safe medication use and also the combination of medicines like NSAIDs and muscle relaxants will work well with the chronic pain. Next, engaging back health through lifestyle changes. Lifestyle changes plays the major role in enhancing the back health. So, how we can engage the back health? Through the lifestyle changes. One is regular exercises have to be done by the patient. Next, healthy weight management, which will act by reducing the strain on the back. Then by posture awareness, have to keep the good posture which helps to prevent the pain. Next, stress management, practices like yoga reduce tension in the back. So the yoga management will give you a complete relaxation in the nerves, so thereby there will be a direct relaxation effect in the muscles which causing pain. Next, improved health will implement the changes leading to healthier lifestyle. Then pain prevention, lifestyle changes significantly help in pain management. So, what are all the effective strategies which can be used to prevent the low back pain? Yes, primarily starts from physical therapy, strengthening exercises, and also proper lifting techniques to further preventing the injury, and also ergonomic workspaces. That is a most important role in the prolonged sitting posture job persons. So, adjusting the workstation to promote the good posture, and also the prolonged sitting posture activities should take a regular breaks during prolonged period of sitting or standing, which helps prevent the stiffness and reduce the risk of the low back pain. So when to seek the professional to help for the low back pain? When there is a persistent pain for few weeks and when the symptom is severe, which leads to numbness and weakness in the limbs, and also if there is any history of the cancer or if there is any sudden injury which is post accident pain, and the timely intervention should be done by the professionals. So you can seek the medical professional help when there is these kind of symptoms or these kind of any of the scenario is there in your low back pain. Take charge of your back health. To conclude this, the low back pain is common yet manageable condition. Understanding its causes, recognizing its symptoms, engaging in proper treatment, implementing some of the prevention strategies are vital step to enhance the quality of life. I personally encourage everyone to prioritize your back health by adopting a proactive approach to prevention and seeking help when needed. Start your journey towards a healthier back today and empower yourself to live pain free. Thank you. Bye.